Next step, you're just placing your hand on upper trapezius, and please pay attention. I even help myself to reach, stretch a little bit arm, to reach the upper trapezius, and little by little I'm relaxing. I allow the gravity to pull down. And now my head is a little bit bent forward. And I can, with the other hand, I will help to create this initial pressure down, 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 down. This pressure transmitting actually through my hand and upper trapezius. Initial pressure, and slowly I move my head up a little bit to the normal position, and slowly my hand go down. And again to initial position, head down, pressure initial, and we start movement. Head a little bit, not extending, but go to the normal position, and head down, initial pressure, and at the time of extension of neck, you're moving. The other hand actually played pretty significant role helping to transmit pressure. And moving down, and again, pressure and movement. First we'll be initiating pressure, and after this, movement. And again, head down, elbow down, initial pressure, actually movement have to be together, but sometime you will feel until enough stretching will be not by this movement created, you don't moving head. Usually it is right, it's flexed, forward bent, and you start with head movement at the same time. Now for upper back mobilization, very simple and a great tool. You'll see I will perform in a few minutes. I will perform with this instrument. You're taking just simple tennis ball, mid-size towel, and you placing like this ball, and around this ball you just folding, rolling this towel. Now a ball here, you see, you're using simple strings to secure. One side, and now this ball in the middle, and I'll ready to demonstrate for you mobilization of upper back structure. Now we will place this instrument in our upper back, and we're applying against door, this kind of frame. We're applying this pressure. You see, with this both ends allowed me to move, and now look, I'm applying this pressure against my back, and here I'm holding. I apply pressure, and after this I move down, and at the same time I help a little bit to perform this strip by pulling with both of my hands. A little bit. I will press again, press, and after this slowly I move. And all kind of close to the spinal column, 3-4 strips like this, 3-4 strips. After this I will place and will contact a little bit near 3-4 strips, scapula, and please pay attention. When I position like this, my arm, scapula, a little bit extending back. And look, and I will place like this against, and I will direct pressure. You'll see all this what I show you right now and explain. I'll demonstrate. And under scapular manipulation, when we placing like this, hands in the hole, we can do. And you know what? Actually, please view under scapula manipulation. If I already stay in this position, you see the ball actually directed under scapula. And in this position, I will stay against frame and will apply pressure directly to what you see with my body, and you'll feel I will direct kind of under scapular pressure and will move a little bit. And again, and I will do this movement and very significant pressure in mobilization. It's really ball right now mobilizing all under scapular structure. And again, you see movement of my body. This is actually mobilization. Pressure there, and I move my body. And tennis ball, you know, pressing it's soft but hard. Soft and hard, it's the right definition. And pushing, as much I push on ball, it's pushing back and allow me to mobilize all this area. Yeah, I can exchange hand, and you see again this allow me movement. Here I place my this ball over here, there, and I here with both hands I'm applying pressure. I press with my back against this ball, applying pressure, and I go down. Yeah, will be also good if camera will show legs also. Yep, my legs, I apply pressure with my back against the ball, and I hold here with both hands, pressure there consistently, and a little bit at a time. At a time when I bend my knee, I pulling the ball, and this would allow me very, very massive mobilization of back. And of course, one side, left side of back from spine, I mean, and right side in the same manner. And just apply pressure. You can even press against frame and apply pressure. It's significant. Yes, actually, you pressing like this, and this how you will eliminate this trigger points. Stay for 30 seconds. Very good. And if this under scapula, you just a little bit directing and you moving. Now look, what we did, we first of all we performed pressure and spontaneously like this. You go down on your legs and you're pulling, and pressure constantly with my back. I'm pressing against this ball. Yeah, we did all this. One strip, second, third, fourth strip, whatever. Depends how wide back of yours. After this, we pressed under with direction under scapula. We first of all we position like this, hands. We're holding. We're directing this ball under scapula, pressing again frame, and also mobilizing this under scapula. Again, under scapula also, you can, like this, you locate it, you compress against frame, leave this hand, and you can press a little bit from frame, and this movement. You'll feel a little bit intuition. Of course, I instruct you, and in the frame of this instruction, you, by feeling what does it cause, you will be able to mobilize very effective. The next step, what you do, you just start again like this. You stretch a little bit, after this compress and do like a kneading.